Hi, I'm Dr. M.S. Narula, Senior Consultant Orthopedics, Spine and Joint Replacement at Apollo Clinics Chandigarh. Today we'll talk about one of the very important conditions that we see in orthopedic practice, and that is knee pain. And specifically I'm going to talk about osteoarthritis of the knee, where there is an age-related wear and tear or degeneration. So briefly to tell you, that patient usually comes around 40-45 years of age when they have difficulty in getting up from a squatting position and climbing stairs, coming downstairs. And this is a normal wear and tear which starts to happen. Early we used to see this disease at 50-55, now at 40-45 also we get this. So the various stages of osteoarthritis, and early, middle and late. So in early stages, when the pain is very mild, we give anti-inflammatory medicines, and there are certain collagen supplements or collagen cartilage protecting supplements where we give these medicines for a couple of months. Hot fomentation and exercises. Exercises are very important. We tell them to do some quadriceps exercise and hamstrings, and there are certain precautions like not to squat, not to sit on the ground, not to sit cross-legged. And exercises and weight reduction remains the mainstay of treatment, and of course physiotherapy remains the mainstay of treatment during the early stage. And when the stage is slightly more pronounced, and when the patient is not responding to the conservative treatment like medicines and physiotherapy, and if the knee is not very bad on an x-ray, so this staging is done on the symptoms as well as on how bad the x-rays look like, because the gap of the bone starts to reduce. A good gap is nice, and when the gap starts to reduce between the bones, that's when we start staging it. So in a little advanced stage, when the patient is not responding to medicines, there is a very good treatment which we call as viscosupplementation, in which we inject a fluid, joint fluid kind of a substance into the joint, and now it gives relief considerably for a few months and sometimes for a few years also. There is also something called as PRP therapy now, which has become very popular, where we take the patient's own blood and we centrifuge it, and it's got a platelet-rich plasma. That is what we inject into the knee joint. So basically we are injecting your own blood. It's a 1-hour procedure into the knee joint, and it promotes the healing. So these two treatments, the PRP and the viscosupplementation, are good for in between stage when the knee is not very bad, and patients do respond very nicely. Of course, then there is a little advanced stage where the knee joint is very degenerated and the bones are absolutely rubbing against each other. Then we give the option of surgery, and we have something called as a total knee replacement, which is a routine surgery, and also a partial knee replacement, where if the knee is not very bad and only the inner aspect, like we have the two aspects of the knee, only if the inner aspect is involved on the x-ray and the patient is not too old, then of course a partial knee replacement has also become popular. But most of the time when patients come to us, they are in an advanced stage of arthritis, where the total knee replacement, the conventional surgery where both the compartments are changed, is recommended, and it's a routine surgery, very successful. And if the important point is that patient should get the surgery done while he is still mobile and walking, because the results depend on what is the body weight and how active the patient is, how good the muscle power is, and how good or bad the knee is. So don't delay this surgery for too long. Of course, we don't advise it too early also, and the cutoff age usually is 50-55. Before that we avoid doing the surgery, but sometimes we have to. Choose your doctor who's experienced, choose your hospital which has all the facilities, and go ahead with this surgery. The third day of the surgery, patient, or second day, sometimes patient is walking. By 5th or 6th day you go back home walking, and it's a very painless, bloodless surgery with very good results. So all the best, and stay safe and take care of yourself. Thank you.